Hi there. This video is for clinicians who are going to be reviewing patients from the sort of CKD, UNE, ACR part of our pathology system. Now, the system will cover a huge amount. These are the reports that drive it. It can be used to update CKD staging, inform the patient, bring patients back for repeat tests. But there are a few bits that need some manual review. And the first we're going to look at is this one. So consider referral to nephrology, and there's the various reasons the system might pick these patients up. So I've sort of set up these test patients to show you how this works. Now, normally we'd launch the pathology template there, but if that's not possible, I've got it on my toolbar, or the way you can do it, just for information. If you press F12 for the launch here and search for pathology, there's our template. There's pages for each of the different kind of results and tests and things that the system will manage. So come to UNE and ACR. These two things are saying largely the same. So first, it's a waiting clinician review. That's partly because part of the system is used by admin staff. So if patients phone up and say, what are my results, what's going on with them, they can use that to tell the patient, your results are awaiting someone to review them. Here we can see that it's saying consider referral to nephrology, and then the reasons are due to the KFRE, the kidney failure risk equation, being greater than 5. Those 3 stars, if you see those, it means that you can right-click an action and the system will do something. If you expand here, you can see it will show guidance, and that brings up the relevant NICE guidance that you may want to look at. So further down here, you can see hopefully useful information like previous CKD coding, entries in this template, in this CKD notes box, latest KFRE, so well above the 5% threshold, and other things. To action this, you've got the options over here. So it might be referrals not needed. Actually, before that, it might be that they're under the care of the nephrologist. So if that's been coded or off a letter in the last 14 months, the system won't put them into this report. But obviously, if your practice isn't coding the letters, or if they've not been seen for longer than that, they might sort of slip through the net. So it may just be they're under nephrology, and that's it. It might be referral not needed or referral refused. Just to show you what happens when I pick one of these, it launches an auto consult, which in this instance has brought some other prompts for me. Don't worry about that right now, but you can see, look, what code has been added, and the patient refused referral, and you could put some notes in here, discuss with patient, declined, whatever it might be. That's useful because these options will take them out of these lists to review for now. But if, say, 6 months later they have other results that are also indicating referral, then they will drop back in for review. So it may be that note still applies, or it may be that this time you think, actually, no, I need to refer them, and you would click referral done. This refer to virtual clinic, you're unlikely to see unless you're in Lincolnshire. But there may be other pathways that we can put in there for you, or make that refer to your own kind of virtual CKD clinics if that's something going on in your area. Whatever you decide to do, it is important to use one of these options, because otherwise they'll stay in the list. You might get another task about it, you might get another query, and also in terms of patients if they're phoning up about their results. Let me show you one other scenario from the reports. And that's recent results that suggest that a patient needs to be on an ACE or ARB. So different test patient here. And we can see, again, pathology template, awaiting review, may require new medication. And then a bit more detail, consider initiating an ACE or an ARB because the latest ACR is more than 70. This fact that they had a new diagnosis and been informed is not something I need to worry about right now, just for info. If the patient had ACE or ARB contraindications in their record, it would show here. If I need to add some, I've got the drop downs for these, which applies for referrals if that's relevant, and also for the system to take them out. I'm not a GP, so I don't know, but I'm guessing more often than not, hopefully you'd be actually prescribing those things, or it might be a phone call that you need, and you would go from there. If you do prescribe the medication, that will take them off that list. There's also a link to CKD template, whichever template that uses, and if you use Arden's, to their helpful CKD formulary. And you might find that a useful place to work. That's about it. If there's information you think's missing from here that'd be really helpful, or buttons over here, again, let us know. We can review those requests and potentially add things on. The idea is this template's not a kind of hoop to jump through, but actually a useful place to see what's going on with a patient and assess what they need. Thanks.